Okay, so today's morning medicine is another spider, aranea scinencia. Scinencia, gray spider, little gray spider from Kentucky, which was transferred over to Europe through trade, and ended up over there. I think that's where they did the provings over in Europe. But it's a gray spider from Kentucky, and then you got arbutus andrachne. I love trying to say these names. Strawberry tree. So the strawberry tree is the second medicine because these are very small medicines. And then I want to continue. The last time I talked about underlining, how to underline the important symptoms, and how you're underlining or you're focused on the wrong symptom as being important will throw you off. And you'll come up with the wrong batch of medicines. Yesterday I was on a call. It's so funny to watch people look at me like, I got a third eye. What are you, the village idiot? So, I got on the call with him to ask a question, and I said, "Hey, you still working out?" Because I remember the last time he started a workout program. He said, "Not as much as I'd like. I hurt my shoulder." I said, "What's it feel like? Is it better by motion? Worse by motion?" I said, "Better by motion's bryonia. Worse by motion's Russ Talks." And he's just sitting there looking at me. And I forgot to throw in Ruta. So he's just looking at me. I'm thinking, all right, well, one day you'll get it. One day my whole goal is to get everybody's awareness into how well homeopathic medicine works. Billy Joel, I just looked it up. There was 3 medicines for hydrocephalus. Now he said they used to call it water on the brain, he said, and then they said he's got they call it hydrocephalus mugumaga. I don't know what the second word was, I don't remember. But it was a form of hydrocephalus, but we don't care what it's like. His balance sucks. Everything's fine, but his balance sucks. So what would I look up? I'd look up balance, but I did look up hydrocephalus, and then there was 3 medicines, apis, calcarb, and tobacco. And I think tobacco had the most dizziness, and so I'd have to ask them, some other things, and a lot of them say balding, the person's going bald. When I look under the head, that person's going bald. So he has gone bald. He's got a balance problem, and they said it's, like water on the brain, which is hydrocephalus or meningitis. It might be he might have said hydrocephalus meningitis. I think he might have used both them words because it was a word with an M at the end. But I guarantee you, he could be helped homeopathically. It'd be like, oh, that's amazing. One day God will get me to one of these big shots, and I will go and I will fix him. And then people will say, dang, boy. So my mother, she went to that doctor to get carpal tunnel fixed. And she got surgery and still not fixed. She's aggravated with him. And I go up, I told her yesterday, I said, I got Ruta, man. I'll give you some Ruta, and this will fix your arm. Okay. So she has almost like a coffee mug. And even if it is a coffee mug, she puts coffee in it, don't matter. I stuck Ruta in there. She'll close it up, put it away next time she uses it. So I don't know when she'll take it, but I'm going to keep doing that with her thing. Just one tablet in there, it ain't even a tablet. It's so tiny. Throw that in there. If I could find her water, I would give it in her water, and then when she left the room, I'd pound it and set it down again. So it's tricky trying to help people, and they don't understand. It's just funny to watch them. Just like my wife, I said, well, what did they say about your foot? Did they come up with any? No, they just called other doctors and said, boy, I've never seen this before. No solution, no nothing, no, even they well, we can cut that out. That's usually what it comes down to. But and then, like I said, I gave her phosphoric acid. I was focusing on, and when I get into case taking, it's going to be interesting because that's what it was. I was focusing on that bump on her foot. I got to get rid of that bump. Ruta, this and that. Then her legs ached. Oh, let's focus on the legs ache. So when you focus on the symptoms, you're not focused on the center of what's going on. You get confused, and you can give all the medicines you want. You're not going to hit it. Until I focused on, I said, okay, let's sit back and look at this. She she wants, oh, then I was, I'm doing deep pressure in her legs. It hurts so bad when I push on it, but it goes away. The perineum, I think it's the peristeum or perineum. I still didn't look up and see what that was, but that deep tissue that I was hitting, I thought, oh, that's it, that's interesting. So let's go look under legs, pain, deep tissue, or peristeum, I think is what it was. Because I googled it. I said, what's a deep tissue? Oh, peristeum. Okay, so I looked under peristeum, and it gave me a few medicines. I looked at them, and one was phosphoric acid that said bubbly. Loves bubbly drinks, and that's phosphoric acid they're using in there. But anyways, um, so far, she said she's on her second bottle. Now she usually just does one bottle and she's done. She don't try it no more, but she knows this one worked, and so the doctors wouldn't have helped her. The doctors, Billy Joey says they don't know what causes. They don't know how they fixing it. He didn't say that. I didn't get to watch the whole interview, but yeah, it's a shame. It just kills me to watch people suffering, and they needlessly suffer because they don't really have to. All right, let's get into the spider. I'll get off my soapbox. And I'm pretty much going to just read things. Aranea scinencia, and arbutus, andrachne, strawberry tree, and the gray spider. Constant twitching under eyes. Now this is the spider. Worse warm room, sleepiness, eyes inflamed, weak watery lids or swollen. Flow of saliva, that has a mercury tint to it. Mercury has a lot of saliva and gum problems. Sweet taste in mouth. I'm not sure if mercury has that. Headache of considerable intensity, especially upper back part of head. Can't collect thoughts. Felt like he was drinking. So they got this, they're swaying. They're not, they're swimming. Okay, so then arbutus. Well, let's read a little bit here. Aranea scinencia. You don't need to see my face. Yeah, whatever. Has been proved. So this is a proving in 1C and 2C dilutions. So even though this, I guess this spider's poisonous, but they've used low doses to do a proving. One remarkable symptom noticed was constant twitching of under eyelids. So that's why this is good for eye problems. That brought that out, depending on the eye problem, basically, which brings this spider into line with Chorea megale, which is another medicine, homeopathic medicine. Okay, the gray spider has sleepiness, eyes inflamed. I think I did that. All symptoms worse in warm room. Okay, let's go to now arbutus andrachne, which is strawberry tree. Eczema associated with gouty and rheumatic symptoms. So they got a lot of arthritis stuff and skin stuff. Arthritis, larger joints. Now, urine rendered clear. So that's, why is that there? Stool, urine, but the urine rendered clear. So I'll read that. And the guy said, seemed to clear up my urine, made it real clear. Lumbago in the back. Well, I don't have kidneys and all that done, so I just was writing symptoms. Symptoms shift from skin to joints. Bladder symptoms. So that's interesting, because homeopaths know that if you have asthma and you take care of it like allopathically, then you will have skin stuff come out. The asthma goes away, the skin stuff comes out. Almost the same thing. Some people, it goes to the joints. So the joints, you take care of like you take care of arthritis. Yeah, that's what it is. Okay, so asthma, skin to asthma, and then arthritis, joints to skin stuff. So you take care of the arthritis and it goes away, skin stuff will come out, then you take care of the skin stuff, push that all out. Now they don't have that problem ever again. Usually. Symptoms shift from skin to joints. Bladder symptoms. So they got bladder symptoms. So that's why I say it's, it's the law, Herring's law of cure. I don't know. I feel dopey today. I feel tired. I don't know what's going on with me. I got to get pumped up. I got a 4-hour meeting today. Thank God we'll be jumping up and down and cheering and clapping, and yeah, it's enjoyable. It's not like some of the when Tony and them guys do these things. It's not like most meetings where you're sitting there and you listen and you speak back and you listen. No, oh, everybody up, because he realizes your brain goes to sleep. So, all right, the arbutus andrachne, the strawberry tree. Now, this is why they came up with it, or thought of it. It's the doctrine of signatures. The strawberry tree sheds its bark annually, which gives the signature of its use in skin cases. So that's the doctrine of signatures. You see a yellow plant and someone's got yellow mucus, usually that corresponds. I'm trying to think of some other ones. There was one with the starfish. I can't remember what it is. Oh, the starfish has like bumps on all over its skin, on top, and that's like anybody that has that kind of carbuncles and stuff and skin stuff that are red like that, you think of a starfish. The other one is it regenerates itself, if you cut something off. So there's doctrines of signatures like that. This one is the tree sheds its bark every year, which gives a signature of skin cases. Okay, arbutus is one of Dr. Cooper's remedies. He cured several cases of eczema with it and observed that it produced pains in the joints of a gouty or rheumatic character. So this is a tincture and all potencies. Yeah, this is under approving. I guess you could probably give it in the tincture form and produce the same symptoms. Hence, he was led to give it in certain invertebrate cases of arthritis. So he was using it for arthritis. In one case, the patient noticed that it cleared his urine. That's where the cleared his urine come from. So he started taking it, tincture or potency, and when he did that, his urine got really clear. So I don't know why it clears the urine. Arbutin has a reputation among the allopaths. Now, it also has a bladder symptoms. So maybe that's what it is. It clears up the bladder, the urine becomes clear, and your urine should basically be clear. Arbutin has, because see, when you eat, if you eat meat and that, and you eat other junk, it isn't clear. Okay, so if you eat lots of greens and fruits and vegetables where you're getting your water, that's the best place to get your water, from the tap, from the thing. You get it from a plant and it's already filtered out. Watermelon, whatever it is, it'll filter things out, and that's the best water you can get. This is probably why it's clearing up the urine, because they have bladder symptoms. It is good for it. I don't know if that all made sense. Arbutin has a reputation among the allopath as a urinary remedy. So even the allopathic doctors of this time was using it. Arbutus is allied to ursae. That's another homeopathic medicine, which belongs to the area. Okay, same plant family. One patient who has benefited by the remedy was worse in northeast winds. I don't know what is that. I don't know. The larger joints are principally affected, and the slightest movement sets up inflammation. Arbutus andrachne is a remedy for eczema associated with gouty and rheumatic symptoms. So that eczema associated with rheumatism and arthritis, unlike apis and is it apis, arsenicum. Those ones are good for asthma and allergy. That's related, then this, like I said, asthma and skin, and then you have joints and skin. So either, it depends on the patient or the person and what type of constitution or miasm they have set up, which will bring out either asthma or bring out the joint problems. The large joints are, okay, wait a minute. Eczema associated with gouty and rheumatic symptoms, arthritis, especially larger joints, urine rendered more clear, lumbago. Lower back problems, symptoms shift from skin to joints, and also good for bladder symptoms. Okay, so now the good part. So the last time I talked about underlying, so like with my wife, let's make this. Yeah, let's keep it there. You don't need to see me. So my wife, she had that thing on her foot, and like I said, I started focusing on. I didn't take a case. I usually never get to take a case because when she's hurting or sick or whatever, you know, she don't want to answer all them questions. That's a symptom in itself. So she doesn't want to answer the questions. So I usually just use my talent, and I didn't realize how good I was getting at this stuff. Let me have a drink of this tea. This uh, Christine, the bee lady, she gave me these bags of tea. I put one in. It was all ginger. Whew, man, I mean, I could drink that one, but it was like it had a bite to it. Ginger and honey, and she put it in these little bags. The next one was jalapenos and honey, and boy, I just couldn't drink it. I threw in a ton more honey. I couldn't. Some people may have liked it, but I couldn't take it, man. It gave me heartburn. Boy, it was a rough. This one, wish she would have marked the bags and know what they are, but this one is, I forget what herb it is. I can't think of what it is. If I gave it to her, she'd probably know right off. But yeah, that's why I'm learning plants. I may have a degree in what to use with the plants. I may have a certificate or whatever from that lady, know what to use plants for. But identifying them, identifying their smells, all that stuff, that's going to take a little while for me to do. So my wife has that problem. And I never took a drink. So I'm looking at her foot. So where am I focusing? I'm focusing on the bump on her foot. It's very painful. I can't even touch it. If I lightly touch it, she's like, I don't touch it. So now I'm able to touch it, you know, after the phosphoric acid. So anyways, then I go for Ruta. Ruta's not working. Okay, what is this? What's going on here? Then, like I said, her legs, I go for aching legs. Calc Carb worked great. Aching went away. Wasn't the remedy. It palliated it. And that's what Robin says. You might pick a medicine that'll palliate it. If you take the medicine away, pain comes back. So then I'm pressing so deep in there using shiatsu. The peristeum, I think that's what it is. Let me look it up. The sheath covering the bones. Peristeum, I think it is. Let's see what peristeum is. Peristeum. There it is. Peristeum, a fiber sheath that covers the bones. I remembered that. So the peristeum, I was saying perineum too, I think. But the peristeum covering the bones, I'm pushing so deep in there. So I used that finally, seeing these things ain't working. I don't have no help from her. What's it feel like? And usually what's it feel like? It just aches. And aches is a big word, so I couldn't get her to say, is it burn? Is it sting? No. She said, touching that bump causes it to burn. So that's something I'll work on later. I'll work on it now because I want to have a remedy ready when the legs, if she doesn't take phosphoric acid no more, if that didn't clear up that bump on the bottom of her foot, which I think it might, if that doesn't work, then I'm going to look up something like foot touching, burning, something like that. So people make it hard on me to come up with a medicine sometimes because they will not. Number one, they have allopathic thinking, and number two, they don't know how to answer the questions. They don't, and I don't know how to draw it out of them because they have that thinking. So, anyways, so the phosphoric acid, I looked that up. Peristeum, deep pain in the peristeum, and her legs pain, or aching maybe, or pain, and then peristeum, in the peristeum, and there was a couple remedies, but phosphoric acid stood out because now if I would have just looked and said, okay, this person likes bubbly water, and that's why they do that. They go, what kind of food do you like? What kind of drinks do you like? You like them cold? You like them hot? Is it better warm room? Worse warm room? Is it, yeah. So you get all these things, and that helps you to direct you. All them symptoms can become confusing if you don't know the center of the case. So center of the case for my wife is, I think, acidity, so that's why phosphoric acid is working. So anyways, I tried phosphorus too. And it said, and that's another thing it said, if phosphorus doesn't work, try, go to phosphoric acid, so yeah, that's kind of how it works. And, like my mom, if she would take that medicine, I most likely could clear up that carpal tunnel, and people don't realize this. They're thinking, man, this guy's an idiot. He don't, I've seen it work too many times that I'm so confident in it that if you send me to Billy Joel, I would ask him a few questions, maybe look in the book, ask him a few more questions, come up with a remedy. It, may have to hit one or two remedies. I don't know, but I guarantee I could find a remedy to clear up that hydrocephalus, meningitis, whatever he's got. I think he said hydrocephalus. They use these big words, He said it used to be called water in the brain. And that's basically what it is. The brain is swelling up because of the water, probably pushing on, some things that are causing his balance to be off. All right, so the first question you ask, what do you want help with? Okay, it's my foot, this and that, whatever. Then you find out, when you get that, what do you want help with? And of course, that is, the last time I was talking about the underlining, you're trying to figure out what is really important here. So then you find out what they perceive as wrong with their vital force. Now, they're not going to know what vital force. You're going to say, so what do you think is wrong? And then they give you their thing. You can write all this stuff down to give you a clue of where things are going, and sometimes you ask these questions and then they might break down and say, I've been so stressed lately because of the, like the Indian guy with the cancer in the ear. I've been so stressed about somebody trying to take my property and that, and he wrote that down, and eventually he asked, I'll get to it. What's the most important thing you want to get rid of? It was his stomach situation. Once he hit that stomach, that directed him directly to where he needed to go. And that's what you need to ask people. Then you ask about their other problems before you begin analyzing. So, what else is going on with you? Is there any other situations you got going on? Any, have you had a grief? Have you had a loss? You want to open-ended questions at this point, trying to get them to open up. And like I said, there's 4 patients, 5 maybe. Open patient, tell you everything. You'll write 30 to 50 symptoms down, Then you got the closed patients. You might get 3 or 4, And then you really got to, when you analyze, you got to really pry it out of them. Then the hypochondriac, they got everything under the book, Do you have this? Yeah, you don't even want to ask a question like that. Just what's going on. Oh, yeah, and what else is going on? You do not want to say, oh, does this, you don't want to, you got to be very careful directing them people because they'll, yeah, oh, yeah, I got that. Oh, I got that too. I think I got that. Then you got the intellectual comes in and tells you exactly what's wrong and what you can do to fix it. So, yeah. So you're dealing, and then you got the hypochondriac intellectual. They got everything in the book. They know what's wrong. They know how to fix it, and they'll tell you what to do. So you got these types, and you're asking these questions according to the person you see in front of you. You get about 3 or 4 symptoms. Ask, out of these, what is the top symptom? So, like I said, you can get 30 or 50 symptoms from some people, or 3 or 4 from some. And then you say, what's the top symptom? What is the one thing, Cindy, mentor of mine, what's her name? Gardner, Sydney Gardner. One thing she would ask is, what's the first thing you'd want to get rid of? And also the other question is, what's the worst thing you'd want to get rid of? What would really make a difference in your life? If you don't pin them down here, you don't know knee pain is the central, what the heck is that again? Central, I can't think. Anyways, you don't sit there with open-ended questions, getting to the point of what is exactly the thing you want to get rid of, some things might be embarrassing. It might be leukorrhea from the vagina. It might be, can't get erections, or, could be I got gonorrhea. Yeah, you don't know. And you really want to stay here until you get like the center of the case, chief complaint. That's what that is. So then knee pain could be in the midst of 30 to 50 symptoms. They could be in the just thrown out there. Yeah, I got knee pain and then my shoulder aches and my other thing and this thing and the other thing. And you don't realize that the knee, not being able to function with the knee, they can't get their housework done. They can't go to work. They're money's problems. This and that because the knee's not functioning. They can't sleep because it aches at night. You know, they may just throw, yeah, my knee aches like crazy and this, and I am not sleeping at night and I don't get this and I don't, and if you don't pin down that all this is centered around the chief complaint, which is the knee, then you can end up, like I did, you know, her chief complaint was her foot was burning, or I mean, aching. She couldn't walk on her foot because of a bubble. Now, is that the chief complaint? No, that's what she's got. My legs ache. Oh, okay, your legs ache, and it's better by deep pressure. So things like that. You get all these symptoms, and then like me, I was going for the bump on her foot first. Instead of, if I would have kept going, what kind of food you like, oh, bubbly water, this and that, I would have got more symptoms that would have directed me towards that whole acidic situation she set up. What foods you like to eat? You don't eat any greens, this and that. That would have set me up to say, oh, she does have an acidic tendency to her body. So um, the the assessment is very important. You see a NatMer picture, but Russ should be first. So this person may, like my wife, she's a NatMer. This person may like salt. They may like, what's some of the NatMer symptoms? Like a depression or whatever. But you see NatMer there. This person has definitely a lot of NatMer. And that's the other thing homeopaths do. We categorize people. You're a calcarb, you're a NatMer, I think I'm a sulfur. Yeah, I'm pretty sure I'm a sulfur. And there can be a couple things in there, but deep down or something. So you see this NatMer, but the knee pain needs to be taken care of first. So then that's why I say you get rid of that knee pain, like that guy. If I got rid of his shoulder pain, now he'd be working out more and he'd get healthier and he'd probably sleeping better, because I think that's why he was doing it, because he looked, after he worked out and he was having that call, he looked really tired. So you're sleeping more, you're functioning, you'll start functioning better. Now you'll see them NatMer symptoms come on, and you can clear some of that up. NatMer can be a grief, it can be there can be some things there that a loss of somebody. NatMer has all those things. Once the knee pain's gone, now you're working on the NatMer to fix things, to go deeper and really get their health, their vitality up. And he says, this is very interesting, because he says, write a little paragraph. Otherwise, you won't remember your insights. So what he's saying is, you just talk to the person, you sit down, while it's still fresh, you write down your insights, because your intuition can tell you a lot. What's going on here? This person doesn't, like my wife, I would have said, when I finally had the insight, it was like, oh, she's acidic. And I started thinking that way after a while. I think this is an acidic problem that is doing that with her foot and causing her legs to ache. There's some kind of, because then, with her diet, as I sat back and, just thought about it, her diet is, no greens, nothing to offset all the acidic foods. So she's really acidic. So until I did that and backed off, you write that paragraph when you go, once you're writing a paragraph about, this person has, like salt, they come in and they have this problem, that problem, this is the chief complaint. So you write it out. Now you have a picture, and that's what you're looking for, an image of what's going on with this person, and then, you got to pick, okay, where to start. NatMer's there, but, this injury is the first top thing that probably needs to be taken care of. So then when you go back too with this paragraph, this person comes back in a few months or something, you can basically, like my wife, maybe a few months down the road, I'll be considering, okay, acidic, this, that, what's next underneath that, can bring up her vitality. I gave her caladium yesterday. She didn't have no cigarettes. I said, oh, here, wait a minute. I come back, I gave her caladium. I said, oh, this is for cigarette withdrawal. Or not having a desire for cigarettes. It'll stop your desire. She took it. She said, she looked at me, so she went and got cigarettes, which is a shame. So you want to understand also the layers, which is different than the illnesses, which is different. Illnesses, injuries, griefs, etc. in life. So layers are, like let's take me for instance. I had walking pneumonia when I was, I don't know what age. I was hallucinating. Okay, that's a layer that's set up, and that's probably why I still have lung stuff and all that going on. I haven't gotten that deep with me yet. um, I have alcoholism in my life. I had something on my ear. I had a surgery on my ear for a cyst or something. I have a left ear eustachian tube, left ear stuff. So that's back in my history. Then I had injuries. Then I had, um, stress. Anyways, you're going through, and each thing that you have, you is a layer that's put on. And within that layer, if it doesn't get taken care of, there could be stages in that layer. You could go deeper and deeper. Like I said, in that MERS layer, Matt Murray's talking about that layer. Oh man, it's 31 already. Oh well, that layer is dang it. That layer is they're very prim and proper. Then they get a little looser, and then by the end, the last stage, they're running around naked. So they'll go backwards, run around naked to, you give them that myrrh to being more proper, and then being really, aggressively proper. All right, so understanding the layers, speculate. This will train your intuition. So you're speculating what's going on here. Write down the prognosis, strength, weakness of the vital force. How strong or how weak is it? Your paragraph becomes your reference. The plan, choose remedy or remedies, potency and frequency, like Natmer 30C 3 times a day and Bryonia 30C for a headache. So, or yeah, Natmer 30C, yeah. So 3 times a day, that's for the fundamental condition. Then Bryonia 30C, like once a week or something for like that headache, or when that headache comes on. The key is to have an image of your case from your paragraph or assessment. So you want that image. What's this picture of this person? From their history to their family stuff, if they have any, to who they are, what they got set up there. And when you have that picture, now that makes it, now you're able to sit back and really take a look and see what's, you find out where there's this, because the chief complaint can be coming from something else. An emotional stress can bring out something in a person, or allopathic drugs could have suppressed something, and now they got a bladder or liver, or, arthritic problem or an asthma problem. So anyways, I'm 3 minutes over. Sorry about that. And that is morning medicine. You can age, but you don't have to get old. This stuff here is really important. These medicines, these smaller medicines, you probably never use them, but it might eventually, once in a blue moon, come in handy. You never know. Yeah. So, all right, that's morning medicine. I will see you tomorrow. Take care of yourself.